Friends, I am Dr. Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue salt therapy, part 32, Phos 1. Full name Magnesia phosphorica or phosphoricum. Mode of action. White fibers in muscles or nerves contain Phos. Due to want of this salt, contraction occurs in muscles and nerves, causing spasm, convulsion, chorea, etc. Different types of involuntary muscular movement. Again, sensory nerves also get damaged during contraction. As a result, various types of abnormal sensation like piercing needles, stings, arrows, cutting sensation from knife, passing electric currents, smarting, burning are felt. These symptoms appear suddenly, goes off suddenly, get worse from light pressure, cold, but better feeling from hard pressure and warmth. Want of this salt causes colic in hollow organs like stomach, picture 1, urinary bladder, picture 2, uterus, picture 3, and gallbladder, picture 4. There are a lot of similarities in actions of Phos and calcarea Phos. In case of lack of MP in body, CP compensates the same. As such, many times it is observed that when MP fails, CP completes the case. In any disease where spasms are noticed like teething in children, spasms of finger in writers, musicians, colic pains of stomach, kidney, gallbladder, uterus, urinary bladder, and in tetanus, epilepsy, hiccup, drawing, pulling pain in muscles, in cholera, etc., which often change in locality, relieved by warmth and pressure, but aggravated by cold. See, this whole paragraph shows the places or situations where MP or Phos should be used. Never forget to give CP where MP is indicated but fails. Mental symptoms of Phos. In case of mental symptoms, Phos acts side by side with Phos because Phos acts on the white matter of central nervous system and Phos acts on the grey matter of central nervous system. If you remember this particular pieces of words, that MP acts on white matter of CNS and KP acts on grey matter of CNS, mind that you grasp the crux of the medicines, the two remedies. So problems of molecular level of one salt match with that of other in the same level. Now the mental symptoms: forgetful, low-spirited, unable to think clearly, perform mental tasks, lamenting and weeping, especially about pain, repeated hiccup, absorbed in monologue or sitting idle with depressed mood, avoidance of performing daily tasks. Look at the picture of 1, 2, 3, 4. Phos for head and scalp symptoms: fainting and convulsion of children, both tonic and clonic. Picture 1, you can see what is tonic and what is clonic phase of spasms. Headache pains, shooting, darting, stabbing, intermittent, spasmodic, shifting, neuralgic, always relieved by warm applications. Nervous headache with sparks before eyes, pain on top and back of head extending to spine, most severe between the shoulders. Picture 2. Headache from occiput spreads over the whole head with nausea and chilliness. Scalp rough, full of dandruff and pustules. Picture 3. Involuntary nodding of head and tremor. Phos for eye symptoms: ptosis, that is hanging down of upper eyelid. Picture 1. This symptom is also controlled by Phos. Pupils contracted, illusion of vision, sparkling and colorful lights before eyes. Picture 2. Photophobia, dual vision. Picture 3. Spasms of upper eyelid. It is also available in this symptom. That is, one can also treat this spasms of upper eyelid with the help of calcarea Phos. Neuralgic pain in eyes. Eyes get squinted. Picture 4. Note, the same child when normal, this is normal, this is when a diseased. Eyes get squinted. Picture 4. Power of vision dim due to weakness of optic nerve. See, what is the level of medicine action? The power of vision dim, if it is due to action of optic nerve, very few medicines are available in other pathies. Now, MAC-Phos can cure this internally. MAC-Phos can cure this difficulty in the nervous system of the optic nerve internally. MAC-Phos for ear symptoms. Problem in hearing due to ailment in auditory nerve. The same thing. Here, auditory nerve can act. Spasmodic or nervous pain in ear, better by application of heat, worse from cold. MAC-Phos for nose symptoms. Smelling power eroded, deformed due to special reasons, not from catching cold. Very serious type of disease this is. The altered smelling not due to cold but something else. Maybe nerve. If it is nerve, then MAC-Phos will cure it. MAC-Phos for face symptoms. Facial neuralgia, as if current passing, arrows piercing, spasmodic. Pain moves about, worse from touch and cold, better from heat application. This is the trigeminal nerve neuralgia, that is facial neuralgia. In this facial neuralgia, MAC-Phos works very nicely. Now this is continuation from slide before. Double dot means always continuation. Rheumatism of face, better from heat application, warm water, but worse in cold environment. If this rheumatism of inflammatory nature, if this rheumatism is of inflammatory nature, that is there is tears from eyes, then ferrum Phos. If tear comes without inflammation, then natrium would be the most efficacious. Note this thing. MP, FP and NM for different situations. MAC-Phos for mouth symptoms. Tearing pain in lips, buccal cavity, spasmodic pain in like tetanus, spasmodic muttering. Subject start talking slowly with teeth pressed. If muttering is due to nervousness, then Phos would be effective. In case of locked jaw, this salt 3x should be given internally with warm water and externally the same should be massaged in powder form over gum, and the result you would wonder to look at. This is the picture of locked jaw. And in lockjaw condition, the medicine should be given in this fashion. The mouth should be opened very small while giving medicines, not this, but this. And this is trigeminal nerve inflammation, that is facial nerve neuralgia. Already this picture has been shown in front pages, slides before. Here it is repeated again. MAC-Phos for tooth trouble, tooth symptoms. During dentition, convulsion and spasms without fever, use KP alternately. This is often seen in babies. Sharp, piercing, spasmodic pain, better from warm application. If better from cold, use FP. If better from warm application, give this MP. Pain migratory, worse from cold wind, worse touch, water and touch. In case we get migratory pain too, but better from cold, worse from heat. If with toothache there is neuralgia of face having the same modalities, MP is still beneficial. This is toothache, neuralgia of face simultaneously, MAC-Phos. If MP fails toothache and there is caries in tooth, then calcarea Phos may give desired result. Sometimes it happens. Like this. That day an aged lady came to my chamber with an abscess of the size of an orange behind her head. The abscess was sitting for last 4-5 months near hairline of the occipital bone. Near the opening, slight deep yellow thick pus mixed with blood was there. Hair was cut there irregularly. Possibly one did it to avoid matting of hair with discharges. The abscess matured long time back, slight pus and blood discharging too for many days, but swelling had no sign of mitigation. There was little pain. Generally, these cases are attended by surgeons of modern medicines, but the head of the family won't allow surgery. As such, she came to me. Following signs and symptoms are collected. She liked open air, but not cold wind. During sleep, she often waked up in fears like young ones. Calcarea salve 12 weeks, twice daily for 5 days, and powdered 3x tab mixing with Vaseline to apply locally was the prescription. After 5 days, noted that swelling minimized by 75%. Fetid water-like secretion still discharging. Salicylate 12x once a day for 5 days was the second prescription. Report arrived on 4th day, swelling almost gone, wounds dried up. With this, the video ends. Thanks for listening and viewing. If you got anything to say, please write down in the comment section. Mind this, the live case may relate to any medicine. It is not that it is for the medicine which is being described here, the live case of that medicine will be demonstrated or narrated. Maybe something else also. This is you can consider this case as separate.